Characterising perioperative redox changes in patients undergoing major cancer surgery. Our understanding of the stress response is incomplete, and here I would like to introduce a novel way to characterise the stress response using reduction and oxidation reactions, or redox reactions for short, which are balanced by the reactions between oxidants and antioxidants, initially triggered by superoxides and nitric oxides. Examples of reactive oxygen species and reactive nitrogen species, respectively. An imbalance of this can lead to oxidative and nitrosative stress, which has the potential to lead to cellular disruption and organ dysfunction. There is evidence that surgery can result in oxidative stress. However, the nitrosative arm of the redox network is less well described. Therefore, our proposed hypothesis was that major surgery would result in increased oxidative and nitrosative stress markers, which in turn would be associated with increased severity of postoperative morbidity. We therefore conducted a single-centre observational study of patients undergoing major surgery. In this study, we measured end products of reactive oxygen and nitrogen metabolism with total antioxidant capacity. Plasma and serum measures included markers of lipid oxidation, such as T-bars, overall antioxidant capacity, including TFTs and FRAP, and products of nitrogen metabolism, including nitrate, nitrite, and cyclic GMP. RxNO, a direct measure of nitrosative stress. Postoperative morbidity data were then collected prospectively and subsequently divided into minor, moderate, and severe groups. The results are as follows. A total of 56 patients underwent surgery. The median age was 67 years, with 70% of them being male. Both oxidative stress, T-bars, and RxNO, a measure of nitrosative stress, increased from baseline to the end of surgery. However, other markers of nitrogen metabolism, nitrite, nitrate, and cyclic GMP, demonstrated uniform decline from baseline to day 1. Markers of total antioxidant capacity took different profiles. Protein-adjusted TFTs, a measure of protein-reducing capacity, increased from baseline to day 1. However, FRAP, a measure of metal-reducing capacity, had increased from baseline to the end of surgery and then decreased to baseline again by day 1. The marker of inflammation, interleukin-6, rose acutely by 70-fold from baseline to the end of surgery. Metabolites of both oxygen and nitrogen reactions were associated with postoperative morbidity. Increase in intraoperative T-bars was 96% greater in the severe morbidity group compared to minor, which was mirrored by changes in interleukin-6. The decline in intraoperative nitrate was more marked in the minor morbidity group compared to severe. So in conclusion, we demonstrated measurable changes in markers of oxidative and nitrosative stress after surgery. Some of these changes are associated with postoperative outcomes. Temporal differences in the origins and chemical reactivity of redox markers have been highlighted, and the importance of nitrogen metabolism during perioperative period have also been brought to attention. Thank you for listening.